Chest pain. Is it just acidity or something life-threatening like a heart attack? Every minute matters, and knowing the difference between angina and a heart attack can literally save a life. In this video, I will explain the symptoms, ECG findings, and troponin test in the simplest way possible. Hello and welcome everyone. If you are a medical student, healthcare worker, or just someone who wants to understand heart health better, this video is for you. Today, we will break down angina versus heart attack, how doctors actually diagnose chest pain, what ECG and troponin tests reveal, and what you should do in an emergency. Initial assessment. When a patient comes with chest pain, the first step is not tests, it's history taking, and ask simple but critical questions like age of the patient, duration of pain, where does the pain occur. Heart-related chest pain is more common in people above 50, but if a young person, say 20 to 30 years old, complains of chest pain, it could be acidity, anxiety, gastritis. Also remember this, if someone says they have had chest pain continuously for a week, it's usually not a heart attack, because heart attacks are acute events lasting minutes to hours, not days. What is angina? Let's understand angina. Angina is chest pain caused by reduced blood flow to the heart but not complete blockage. It occurs during physical activity like walking, climbing stairs, carrying weight, and most importantly, it relieves with rest. For example, a person walks one round in the park, but on the second or third round, chest pain starts. They rest for 5 to 10 minutes and the pain goes away. That's classic angina. Now, what is a heart attack? Now, heart attack, also called myocardial infarction. This happens when a blood clot completely blocks a coronary artery. As a result, blood supply stops, oxygen supply stops, heart muscle starts dying. The pain here is severe, crushing, continuous. Patient often describe it as a heavy pressure or stabbing pain. This is a medical emergency. ECG findings. One of the first tests done is an ECG. Doctors look for specific changes. ST elevation suggests heart attack. Dynamic or mild changes could be angina, but one ECG is not enough. We do serial ECGs. If changes worsen, it is an ongoing heart attack, but if they improve, it is more likely angina. Troponin test. To confirm heart muscle damage, we use the troponin test. Troponin is a protein released when heart muscle cells die. It takes about 6 to 7 hours to rise in blood. So, if the first test is negative, don't relax yet. Repeat it after a few hours. Positive troponin, heart attack is confirmed. Negative, twice, heart attack is unlikely. So the key differences are angina, it is a activity related and it's relieved by rest, whereas heart attack is sudden, severe, continuous pain. What to do in a heart attack? If you suspect a heart attack, act fast. Initial emergency medicines include aspirin, clopidogrel, atorvastatin. This helps thin the blood, prevents clot growth. Then immediately shift the patient to a hospital with a cath lab for angiography and angioplasty. If that's not available, doctors may give clot bursting drugs to dissolve the blockage. Golden period. The first 1 to 3 hours after a heart attack are called the golden period. If treated within this time, heart muscles can be saved, life can be saved. Delay can lead to permanent damage or death. Conclusion. So remember, angina is pain on exertion relieved by rest. Heart attack is sudden, severe and continuous pain. ECG and troponin help confirm diagnosis. Early action saves lives. Never ignore chest pain. So finally, if you found this video helpful, like, share and subscribe for more medically accurate and easy to understand content. And comment below what topic should I cover next. Thank you.